Hello, hope you're doing well today. We are finishing up chapter 13, and this is part 4. We're going to be talking about anabolic hormones and other ergogenic substances. Here we go. So anabolic hormones are critical in the regulation of growth, muscle development, and overall metabolism. They play a significant role in the body's ability to synthesize proteins and increase muscle mass. Some of the most prominent anabolic hormones include testosterone, human growth hormone or HGH, insulin and insulin-like growth factor, IGF-1. Testosterone is a naturally occurring steroid hormone that promotes muscle growth, increases bone density, and influences male sexual characteristics. Synthetic derivatives of testosterone, known as anabolic steroids, have been used by athletes to enhance performance and increase muscle mass for over 60 years. These substances work by mimicking the effects of testosterone, leading to increased protein synthesis and muscle hypertrophy. Now, there are some prohormones that are testosterone precursors, and they are marketed as dietary supplements that purportedly convert to testosterone or other anabolic hormones in the body. These substances include androstenedione and dehydroepiandrone, or DHEA, and others. To break this down a little bit more, human growth hormone, or HGH, also known as somatotropin, is a peptide hormone secreted by the anterior pituitary gland. It is transported through the bloodstream and affects numerous tissues throughout the body. HGH stimulates the liver to produce insulin-like growth factors like IGF-1 and IGF-2, which mediate many of its physiological actions. As far as the effects of HGH on bone growth specifically, HGH stimulates the growth of bones, which is particularly important during childhood and adolescence. In adults, it helps maintain bone density. HGH also promotes the development of muscle tissue by enhancing protein synthesis, which can lead to muscle hypertrophy and improved muscle function. Now, HGH influences metabolism of proteins, carbohydrates, and fats. So it promotes the breakdown of fats in lipolysis and enhances glucose utilization and supports protein synthesis, contributing to overall body composition. In the 1990s, genetically engineered HGH, or recombinant HGH, was developed. It was intended to treat HGH deficiency due to hypopituitarism in children and to provide health benefits in the elderly. Studies by Rubeck et al., Widowson and Gibney and Widowson et al. Found that our recombinant HGH therapy helped to decrease body fat, increase lean body mass, and increase VO2 max in individuals with HGH deficiency. There are some limitations in that the recombinant HGH therapy did not increase muscle strength. The increase in lean body mass was primarily due to water, not necessarily muscle tissue. And so despite changes in body composition, there really wasn't any improvement in strength. So while recombinant HGH therapy shows benefits in specific medical conditions, it's not effective for enhancing muscle strength. The safety and legality of the recombinant HGH as an ergogenic aid are questionable outside of medical contexts. Testosterone is a natural hormone produced by the testes in males and to a lesser extent by the ovaries in females. It plays a crucial role in muscle development, bone density, and the regulation of secondary sexual characteristics. Now, anabolic or androgenic steroids, or AAS, are synthetic derivatives of testosterone designed to maximize its anabolic effects of muscle building while minimizing androgenic effects, male sexual characteristics. To give a little bit of historical context, in 1936, the Olympic Games, testosterone and AAS have been used since the 1936 Olympic Games to enhance physical performance. Now, its use is widespread among athletes of all ages seeking to improve performance, with some estimates suggesting significant use even at amateur and high school levels. And basically what you see is an increase in lean muscle mass. So testosterone and AAS significantly enhance protein synthesis, leading to muscle hypertrophy. These substances promote fat metabolism, which reduces body fat percentage. So both with and without resistance training, testosterone and AAS can markedly increase strength. Now, there are some safety of testosterone and AAS health risks. There are cardiovascular issues. So AAS use can lead to elevated blood pressure, altered cholesterol levels, and increased risk of heart disease and stroke. The oral AAS in particular can be hepatotoxic, potentially causing liver damage or liver cancer. And long-term use can suppress natural testosterone production, leading to testicular atrophy, infertility, and gynecomastia, which is the development of breast tissue in men. AA use has been linked to mood swings or psychological effects associated with it, aggression, and psychiatric disorders. And there are other risks as well. So some side effects can include acne, hair loss, and increased risk of tendon injuries. There's also the legal status of testosterone and AAS regulations. So testosterone and AAS are banned by most major sport organizations, including the World Anti-Doping Agency and the International Olympic Committee. Athletes caught using these substances face severe penalties, including suspensions, fines, and lifetime bans from competition. In many countries, AAS are classified as controlled substances. Their non-medical use, possession, or distribution is illegal and subject to legal penalties. Now, it can be used for medical use. So if it's prescribed legally by a doctor for specific medical conditions, such as hypogonadism or delayed puberty. However, non-medical use for performance enhancement is illegal. And typically, as far as administration of testosterone, it is typically injected because oral ingestion leads to catabolism by digestive enzymes. And while oral forms of testosterone have been developed, they often pose a higher risk of liver damage due to their hepatotoxic nature. Now, if we look at the mechanism of action of anabolic and androgenic steroids, they are synthetic derivatives of testosterone designed to enhance its anabolic properties or muscle building while minimizing the androgenic effects. The mechanism AAS exerts their effects can be understood through the following steps. So it enters into the cells. AAS are lipophilic or fat-soluble molecules, and it allows them to easily cross cell membranes and other target cells. It binds to androgenic receptors. So once inside the cell, AAS binds to androgenic receptors in the cytoplasm. These receptors are specific proteins that are activated by androgens, such as testosterone and AAS. The AAS and AR complex undergoes a conformational change that allows it to translocate from the cytoplasm into the nucleus of the cell. And there it binds to DNA. So in the nucleus, it binds to specific DNA sequences known as androgen response elements, or ARES, and that binding initiates the transcription of specific genes. So gene transcription and protein synthesis begins to occur with the binding of the AAS and the AR complex to ARES. It stimulates the transcription of target genes, leading to the production of messenger RNA. The messenger RNA is then translated into proteins by ribosomes and the cytoplasm. These proteins include enzymes and structural proteins that promote muscle growth and other anabolic effects. If we look at the anabolic effects, what happens is that there is an increased protein synthesis, which is essential for muscle growth and repair. That leads to an increase in muscle mass and strength. And there's that inhibition of protein degradation, so that AAS reduces the activity of catabolic pathways that break down proteins, thereby preserving muscle mass. And there's an enhanced nitrogen retention. AAS promotes the retention of nitrogen, a key component of amino acids, which are the building blocks of proteins. This positive nitrogen balance is essential for muscle hypertrophy. And then there's a stimulation of satellite cells. So AAS activates satellite cells, which are involved in muscle repair and growth. These cells fuse with existing muscle fibers, increasing their size and strength. Now, the androgenic effects, which are the secondary sexual characteristics, they influence the development of male secondary sexual characteristics such as facial hair and deepening of the voice and an increased libido. Androgens also play a role in the regulation of sexual and reproductive functions, affecting spermatogenesis and libido. And there are additional pathways as well. So it increases in red blood cell production, stimulating that erythropoiesis, which is the production of red blood cells, and improves oxygen delivery to muscles and enhancing endurance. There's also the alteration of metabolic pathways, so it influences the metabolism of carbohydrates, fats, and proteins, leading to changes in body composition, such as reduced fat mass and an increase in lean body mass in the terms of increase in muscle mass itself. The use of testosterone and anabolic or androgenic steroids for gaining body weight and strength is associated with numerous health risks. These risks can be broadly categorized into cosmetic-related effects, reproductive effects, and other systemic health risks. Based on these risks, the use of steroids, testosterone, or AAS is generally not recommended for enhancing physical performance or appearance. As far as cosmetic-related effects, facial and body acne, there is an increase in sebaceous gland activity that leads to acne, which can be severe and persistent. Gynecomastia in males, so the hormonal imbalances can cause the development of breast tissue in men. And premature baldness, there's an accelerated hair loss, particularly in those genetically predisposed to male pattern baldness. And masculinization in females, there's a development of male secondary sexual characteristics in women, such as a deeper voice and increased body hair. And then facial and body hair growth in females as well, so unwanted hair growth on the face and body. There is a premature closure of bone epiphyseal growth plates in adolescence, so stunted growth due to the early closure of those growth plates and bones. And again, the deepening of the voice in females. It can be a permanent change in voice pitch due to the thickening of the vocal cords. And other reproductive effects are a reduction of testicular size. So there's testicular atrophy due to suppressed natural testosterone production, and a reduction of sperm production. So there's a decreased spermatogenesis leading to infertility, and a decreased libido with a reduced sexual desire and drive. And for some males, impotence. Developing and achieving or maintaining an erection is difficult. There's also an enlargement of the prostate gland. So there's an increased risk of benign prostatic hyperplasia or BPH and potential progression to prostate cancer. And oftentimes what you'll find in females in particular is an enlargement of the clitoris, which is often irreversible. Other additional health risks are an increased risk of hypertension, heart attack, strokes, and altered lipid profiles. There's an elevated LDL with a decreased HDL, and liver damage. So there's potential for liver toxicity, hepatic tumors, and pilosis hepatis, which is a blood-filled cyst in the liver. There's also, it creates kidney damage, which is it creates a strain on the kidneys and increased risk of renal failure. There are other psychological effects as well: mood swings, aggression, and depression, and other psychiatric disorders. And then tendon injuries. There's an increased risk of tendon damage and rupture due to disproportionate muscle growth. And beyond that, immune system suppression. So there's a potential impairment of the immune response. And in some cases, with gynecomastia surgery, a surgical intervention is required to correct that gynecomastia. So in conclusion, the use of testosterone in AAS can lead to significant and potentially irreversible health risks. These risks span cosmetic changes, reproductive health issues, and serious systemic complications. Due to those dangers, the use of AAS for the purpose of enhancing physical performance or appearance is not recommended. And athletes and individuals seeking to improve their physique or strength should consider safer and legal alternatives such as optimized training programs, balanced nutrition, and proper recovery strategies. Go into a little bit more detail on the psychological effects. We talked about the increased aggressiveness and possible violent behavior. Really what they see is with AA use, there has been associated with heightened aggression, irritability, and mood swings. Sometimes it's referred to as roid rage. This can lead to violent behavior and significant interpersonal issues. And if you look at the cardiovascular risk factors in diseases, the atherosclerotic serum lipid profile specifically, it can adversely affect lipid metabolism, leading to an atherogenic profile that increases the risk of cardiovascular diseases. And much of that could be from the decreased HDL cholesterol. So the high density lipoprotein, the good cholesterol, it's typically reduced, which is detrimental to cardiovascular health. And then there's the increase in LDL cholesterol. So the low density lipoprotein, which is the bad cholesterol, is typically elevated, contributing to the development of atherosclerosis. And then hypertension is a common side effect of AA use as well, increasing the risk of heart disease and stroke. AAS can also interfere with glucose metabolism, potentially leading to insulin resistance and an increased risk of type 2 diabetes. There's also an increased size of the left ventricle. So the left ventricle of the heart may enlarge, which can lead to reduced heart function and increased risk of heart failure. Additionally, there's a combination of high blood pressure, altered lipid profiles, and other cardiovascular changes that increases the risk of cerebrovascular accidents or strokes. So the increased risk of coronary artery disease, heart attacks, and other forms of cardiovascular disease are related to AA use. Liver, there's also a change in liver function. There's a jaundice that occurs, a yellowing of the skin and eyes due to liver dysfunction, and pilosis hepatis, which is the blood-filled cysts that develop in the liver and can rupture and cause severe liver damage or hemorrhage. There's increased risk of benign and malignant liver tumors. And again, with the athletic injuries, the tendon ruptures, so that disproportionate muscle growth and increased muscle strength without corresponding increases in tendon strength can lead to tendon injuries and ruptures. Because of all of this, the use of anabolic and androgenic steroids is strictly prohibited by WADA. This ban applies to both training and competition, reflecting a zero tolerance policy toward performance-enhancing drugs to ensure fair play and athlete health. Some AA users may attempt to obtain prescriptions illegally from physicians, but may acquire these drugs through the black market. The quality and safety of these drugs are not regulated, and they may contain harmful contaminants of incorrect dosages. Homemade or counterfeit AA AAS pose additional health risks due to potentially hazardous ingredients. The American College of Sports Medicine has taken a firm stance against the use of AAS in sports, highlighting the associated health risks and ethical issues. NATA, the National Athletic Trainers Association, condemns the use of AAS, emphasizing the potential for harm and advocating for a clean sport. And the National Strength and Conditioning Association also opposes AA use, aligning with other major organizations in promoting athlete health and fair competition. In the United States, AAS are classified as Schedule III controlled substances under the Controlled Substances Act. This classification reflects the potential for abuse and dependence, along with accepted medical uses under strict regulation. Despite the restrictions, AAS may have approved medical applications, particularly in treating certain conditions in aging adults, such as hormone deficiencies and muscle wasting diseases. These uses are carefully monitored and prescribed by healthcare professionals. So what are prohormones? DHEA and androstenedione are compounds that are precursors to testosterone. They are classified as prohormones. They can be converted to testosterone through metabolic processes in the body. Now, DHEA and its sulfate form, DHEAS, are naturally produced in the adrenal glands and gonads. They can be converted into androstenedione and subsequently into testosterone in various tissues, including fat and muscle. DHE levels are high in young adults, but decrease with age, which has led to interest in supplementing these prohormones to maintain youthful hormone levels. Prohormones can be derived from certain foods, such as wild yams, though these natural sources do not directly convert into active hormones in the body without chemical modification. Prohormones like DHEA and androstenedione were once marketed as dietary supplements, touted for their potential to increase testosterone levels, enhance muscle mass, and improve athletic performance. But in 2005, the U.S. Food and Drug Administration reclassified these substances as controlled drugs, similar to anabolic steroids, due to concerns over their safety and potential for misuse. Now, the effectiveness of prohormones as ergogenic aids is debated. Some studies suggest they may slightly increase testosterone levels, but the increases are generally modest and not likely to produce significant improvements in muscle mass or athletic performance. And many of the purported benefits might be due to the placebo effect rather than actual physiological changes. So some key concepts to anabolic hormones. The use of anabolic drugs or hormones to increase body weight may be effective, but may also lead to a variety of health problems. The WADA prohibits the use of anabolic hormones in sports training and in competition. Research has shown that prohormone dietary supplements marketed as anabolic agents do not effectively increase muscle mass or strength, and they have been classified as controlled anabolic steroids, and their use is illegal and banned by the WADA. So just good to steer clear of anabolic hormones in general. We're going to transition from talking about anabolic hormones to ginseng and other herbals. Here we go. Herbal products have been used for centuries for their purported health benefits. Various cultures have relied on herbs for medicinal purposes and general well-being. Herbs contain a range of nutrients and phytonutrients which are believed to contribute to a healthful diet and offer potential health benefits. In the United States, herbal products are regulated as dietary supplements. This means they are not subject to the same rigorous testing and approval process as pharmaceutical drugs. In some countries, herbal products are regulated as drugs, requiring more stringent testing for efficacy and safety before being marketed. And most herbal products are marketed for their potential to improve health, well-being, or performance. However, The claims are often not backed by robust scientific evidence. While well-controlled research on the efficacy of most herbal supplements for health outcomes is limited, the available studies often have mixed results, providing little or equivocal support for their efficacy. And specifically, if we talk about echinacea, there have been studies that have found that echinacea decreases the odds of developing the common cold by 58% and reduces the duration of a cold by about 1.5 or 1.4 days. Now, the study by Karshvolk and others, really what they found were inconsistent results. So the review indicated that while there might be some preventative effects of echinacea, the evidence is consistent, and rigorous randomized trials have not consistently demonstrated its efficacy in preventing or treating the common cold. Many herbal supplements are marketed with claims of aiding in weight control. While some herbals may have some potential effects on weight management, their safety and efficacy are often not well established. As far as a study by Smith and Krigsman, Hoodia gardoni is marketed for its potential to decrease appetite, which could lead to weight loss. So there is some appetite suppression that does occur. But according to the efficacy and risk, the high doses may be effective in reducing the appetite, but they also can cause significant side effects such as hypertension and loss of muscle mass and gastrointestinal discomfort. Now, a study by Brewer and Chin, they found that there were some herb and drug interactions. So some herbal remedies, especially those marketed for weight reduction, may interact with medications. These interactions can be significant and potentially harmful, and specifically could lead to liver injury, where the involvement of cytochrome P450 enzymes in metabolizing both drugs and certain herbs can lead to liver injury. And that in particular causes concern with long-term or high-dose use of certain herbal supplements. So let's talk about ginseng and swajia. Swajia is a Siberian ginseng. There are common forms of ginseng. Some of those are Chinese or Korean ginseng. And often they are used in traditional medicine to boost energy, improve mental function, and enhance overall vitality. The American form of ginseng, also known for its potential to reduce stress and improve immune function. Now, the Japanese ginseng has similar properties to Panax ginseng, which is related to Chinese or Korean ginseng, and it is used for its adaptogenic effects. Now, the Russian or Siberian ginseng is not considered a true ginseng, but used similarly to increase endurance and resilience. And the swajia, also known as Siberian ginseng, is a Chinese herb used for its adaptogenic properties. It is claimed to help improve physical performance and enhance endurance. Now, as far as the research associated with it, effects on performance, there are some changes with endurance and fatigue. Some studies suggest that ginseng may have a positive effect on physical endurance and may help reduce fatigue. However, results are mixed and not consistently supported across all research. There's also a possible improvement in cognitive function and mental clarity, which can indirectly benefit sports performance by enhancing focus and reaction time. There is limited evidence suggesting ginseng may aid in muscle recovery, but the data is not robust. And as far as scientific results, research findings on ginseng's effect on exercise and sports performance are varied. While some studies report positive effects, others find minimal or no impact. Now, with swajia or the Siberian ginseng, as far as effects on performance, Swagia is often used to improve endurance and physical adaptation to stress. Some studies suggest it may enhance physical performance and recovery by increasing endurance and reducing fatigue. It may also help the body cope with physical stress, potentially improving recovery times after intense exercise. But there is varied evidence and its effectiveness in enhancing exercise performance. It is very limited, and while some studies show beneficial effects, others do not find significant improvements. To continue our conversation on whether ginseng or swagia enhance exercise or sport performance, we'll talk about the mechanism of ginseng, and specifically on the hypothalamic, pituitary, and adrenal axis, or HPA. Ginseng is thought to influence that HPA axis, which plays a role in the body's response to stress. That might help improve the body's ability to handle physical stress and fatigue. Ginseng may also enhance immune function, which could support overall health and recovery, indirectly benefiting exercise performance. Now, early research, particularly from Russia, suggests that ginseng acts as an adaptogen, which helps the body reduce fatigue, resist fatigue, and cope with the catabolic effects of stress. That could theoretically enhance physical performance by reducing the impact of stress on the body. As far as other potential effects of ginseng, what they see is that it could improve cardiac function and blood flow, potentially enhancing oxygen delivery to muscles during exercise. Some studies suggest ginseng could improve the body's ability to utilize oxygen during physical activity, which might contribute to better endurance. There is evidence suggesting that ginseng may decrease lactic acid levels during exercise, which could help delay fatigue. And as there's also muscle glycogen synthesis, so ginseng might promote that increased muscle glycogen synthesis after exercise, aiding in recovery. And a positive effect, it also has a positive effect on nitrogen or protein balance, which is important for muscle repair and growth. Now, if we look at swagia, the mechanisms, it's similar to other forms of ginseng. It is thought to have adaptogenic properties, which might help the body manage stress and fatigue more effectively. However, specific research on the mechanisms of swagia and enhancing exercise performance is less detailed compared to the Panax ginseng or American ginseng. If we look at other herbal supplements and their purported ergogenic effects, we look at capsicum, which is often associated with chili peppers, and the effects associated are that there is an increase in energy. The mechanism behind that is that capsicum is thought to stimulate metabolism and thermogenesis, potentially leading to increased energy expenditure. However, evidence supporting its ergogenic effects is limited. Now, gamma oryzanol is found in rice bran oil, and the effects associated are that it increases muscle mass. The mechanism behind that theory is that the gamma oryzanol may influence the endocrine system and support muscle growth, but research is mixed and not definitively supportive of its effectiveness as an ergogenic aid. Tribulus terrestris, most common name is tribulus, and the effects are, or the purported effects are that there is an increase in testosterone levels. Now, as far as the mechanism is concerned, tribulus is believed to boost testosterone levels, which could potentially improve muscle mass and strength. However, scientific evidence is inconsistent and studies have shown mixed results regarding its ability to significantly increase testosterone or improve performance. Now, cordyceps sinensis, or just cordyceps, helps to, its purported effects are that it improves heart and circulation, increasing oxidative capacity and endurance performance. And the mechanism behind that are that, or thought to, cordyceps is thought to enhance oxygen utilization and improve endurance by increasing ATP production and reducing fatigue. Some studies suggest benefits in terms of improved exercise performance, but more research is needed to confirm those effects. Now, rhodiola rosea, or just rhodiola, its purported effects are that it enhances endurance performance. The mechanism behind that are that rhodiola is an adaptogen believed to improve endurance by increasing ATP turnover and reducing fatigue. It may also have a stimulating effect on physical and mental performance. The research suggests there are some potential benefits, but more rigorous studies are required. And epigallocatechin, or 3-gallate, the EGCG, is a flavanol found in green tea. There are antioxidant properties that help with reducing oxidative stress and enhanced exercise performance. EGCG is known for its antioxidant properties, which may help reduce that oxidative stress and inflammation, potentially enhancing recovery and performance. Some evidence supports its role in improving exercise performance, though results vary. So what herbals are effective ergogenic aids? There have been some purported effects for Cytoceria canarianus that increases muscle mass and decreases body fat. The mechanism is that it is believed to inhibit myostatin, which is a protein that limits muscle growth. By inhibiting that myostatin, this herb might theoretically promote muscle development and fat reduction. Evidence supports these effects is limited and needs further investigation to establish its efficacy and safety. With echinacea, the purported effects are that there is an increase in red blood cell production. The mechanism behind that are that echinacea may increase serum erythropoietin, a hormone that stimulates red blood cell production. This could potentially enhance endurance by improving oxygen support. Now, the research on echinacea's impact on athletic performance is inconclusive. While it may support immune function, evidence for significant ergogenic benefits is limited. For many herbal supplements, including those mentioned, research on their ergogenic effects is often limited or not well established. Most studies do not show significant ergogenic effects. Now, herbal supplements can vary widely in their quantity, their quality, and their ingredient composition. Many products may contain multiple ingredients, which can complicate the assessment of their effectiveness and safety. Athletes should be aware of potential side effects and interactions between herbal supplements and other medications. Herbal supplements can have unexpected effects or interact with drugs, which can pose risks to health. There are 4 categories of sports supplements that are proposed in a joint position statement of the American College of Sports Medicine, the Academy of Nutrition and Dietetics, and the Dietitians of Canada. And the Australian Institute of Sport has a very similar system where they have Group A supplements, sports supplements. These are considered to be safe, effective, and permissible and are well supported by research. They have a solid safety profile and are allowed by sport organizations. Some examples of this are creatine, which we know enhances strength and muscle mass and is well researched and safe for most users. Protein supplement supports muscle repair and growth and is effective when used to complement dietary protein intake. Caffeine helps to improve endurance and cognitive performance, and it has been widely researched and generally safe in moderate amounts. Now, Group B are those supplements that may be effective, safe, and permissible, but they really need additional research. So they have shown some potential benefits and are generally considered safe and permissible, but research is needed to fully confirm their effectiveness. So examples of that would be beta-alanine, where they may improve high-intensity exercise performance, but buffering lactic acid. branched chain amino acids, or BCAAs, potentially aid in muscle recovery and reduce exercise-induced fatigue, though more research is needed. And nitrate from beetroot juice may enhance endurance by improving blood flow and reducing oxygen costs during exercise. Group C supplements are generally not effective. They have little to no scientific evidence supporting their effectiveness for enhancing performance. One of those would be HMB, or beta hydroxy beta methylbutyrate. And there are mixed results in research, with many studies showing minimal benefit for most athletes. Glutamine, although popular, evidence for its efficacy in improving exercise performance or recovery is limited. And then group D supplements. These are considered not safe or permissible. And so there are significant health risks, or they're banned by sport organizations such as the World Anti-Doping Agency. An example of that would be anabolic steroids. It's highly effective for increasing muscle mass, but it's illegal and banned by WADA and associated with serious health risks. Ephedra is banned by many sport organizations due to its serious health risks, including cardiovascular issues. And certain stimulants may have severe side effects and are banned in sports due to their performance enhancing risks and health risks. So some key concepts are: results from well-controlled research indicate that ginseng and related adaptogens, such as Suija, are not effective ergogenic aids. There is limited well-controlled research regarding the effect of herbals on exercise or sports performance, and that which is available suggests that herbal sports supplements are not effective ergogenic aids. And that is all that I have. You guys have been great. I appreciate you joining me throughout the semester. Y'all have a great day.